We shall be doing the examination of the peripheral vascular system. This comprises of three systems that have been linked together, which includes the arterial system, the venous system, and the lymphatic system. We shall commence with the examination of the arterial system. Please remember that all structures need to be adequately perfused in order for them to have normal functionality, and so any sort of reduction of this perfusion can then cause compromise with the arterial system. So when we examine the arterial system, we're essentially examining for decreased perfusion. Okay, so we shall be utilizing our 4 skills, that is inspection, palpation. We shall not be using percussion, and we shall not be using auscultation except for very special areas which will be mentioned. There will also be special tests which will be including other material. The tools that will be needed for this examination are as follows: a tourniquet, which can be made of rubber usually. We will be needed a tape measure, usually with both inches and centimeters, and we may require the use of a stethoscope, which will be mentioned at the appropriate point. So before we actually start the examination of the arterial system, we would like to remind you that first of all we will do the Y-peep, which, as you guys know, it has been mentioned before. It will be including all the different modalities, and then vital signs, which will be done also before you start the examination. Now we will talk about the examination of the arterial system, specifically the skill of inspection. Now, it should be noted that all of the compromises can usually be divided into acute and chronic. Acute compromise of the arterial system would usually involve changes that can be noted in the hair, in the appendages, which is usually including the hair and skin, and then after that it can actually go on to chronic changes, which can then affect other parts of the arterial system. So on inspection, we expected to, first of all, make sure that the patient is seated on a chair or a bed. During the examination of the lower limbs, the patient should be lying on the bed, as long as this permits the inspection of the posterior leg. The examination is usually divided into upper and lower limbs, although you're going to be inspecting essentially for the same things in both areas. Examination of the upper limb requires that the upper limbs to be completely exposed, as is demonstrated here. And examination of the lower limbs requires that the patient remove pants, shoes, socks, and also be adequately draped so as to keep the genitalia covered where necessary. You are also expected to look for obvious signs of compromising factors, such as an amputation, prosthetics, looking for obvious signs of smoking, like evident packets of cigarettes, or for oxygen depletion, for example, a tank of oxygen that the patient needs to be using. We will then, the inspection is going to be following the format of the flow of the blood, which when compromised tends to first affect the skin, followed by the subcutaneous, the muscles, and the nerves. So we will first start the inspection of the skin, and its appendages, and here we will be looking first of all for symmetry of the skin on both upper extremities. We'll also be looking for any signs of dryness or shiny appearance. These are all very characteristic of arterial compromise. And then we will continue by looking at the appendages, such as those of the nails, of the fingers, in which case we will be looking for thickening or ridges of the nails. And we will also be looking at the hair distribution, in which case we are looking for loss of hair. Remember, the hair patterns are very characteristics of ethnicity and sex. We should also be looking at the limbs for any signs of the pallor. So this is best checked in the skin, where we can look in the palms of the hands for any pallor. We shall now proceed with the palpation of the upper extremities. The upper extremity is going to be palpated for changes in temperature, and this should be done bilaterally using the backs of your hands, for this is the area that is most sensitive to temperature differences. You should be sure that you do them both on the external surfaces as well as the medial surfaces. Next, we will be continuing the palpation process by checking for the pulses. Here, primarily, we will be checking for the 3 pulses of the upper extremities, which are the brachial pulses, the radial pulses, and the ulnar pulses. For these pulses, we will determine whether each pulse is normal, which is rated as +2, or diminished, which can be rated as +1 or 0. This will suggest a reduced vascular perfusion to the limb due to vascular disease. So we will first start with the radial pulse, which should be done using the index and middle finger. And it should be done comparatively with the other extremity. Then we will proceed with the palpation of the ulnar pulse with the location that has already been mentioned. It's been demonstrated. We will then proceed with the special test for the upper extremities, which is called the Allen's test. The Allen's test is going to be performed. You will first locate the radial and the ulnar pulses with the thumb over the pulse region, and the index finger will be over the wrist. You will maintain pressure over these pulses while you tell the patient to make a tight fist, and then you will compress both vessels simultaneously. Then you ask the patient to release, and then you will release one pulse first, simultaneously looking at the palmar surface for refilling and returning of color. This process is then repeated for the other artery. The same procedure is then carried out in the other extremity. The color should generally return within 3 to 5 seconds. If there is decrease in, if the pallor is maintained or the color takes a longer time to return, then there's usually a case of compromise of the integrity of the palmar arteries. We will then proceed with the examination of the lower limb. As mentioned before, ideally the patient will be placed in a decubitus position, and the examiner will then start his inspection on the right side or at the foot of the bed. Inspection of the lower extremities will proceed just as we did previously in the upper extremities, where we will first start with the skin, and we will be looking for any signs of shininess, of dryness, of changes in trophism. We'll also be looking at the nails for ridges or thickening, and we will also be looking for hair distribution. Here specifically, we shall be inspecting the area of the interphalangeal dorsal region of the great toe for loss of hair. We shall also be looking for the presence of ulcers in the region of the lower, the soles of the feet, and the malleolar regions and the tips. What should be mentioned here is that the ulcers that are arterial in nature generally tend to be dry, and you can refer to the table in the first part of this exercise to see the comparison between venous and arterial ulcers. Then inspect for the presence of ulcers, and please note that ulcers that you find in the sole of the feet tend to be because of neuropathic changes, and those in the tips of the feet primarily because of arterial insufficiency. Right? Of note here if we encounter gangrene, we should realize that this is the end stage of an arterial insufficiency. Please note that it usually first starts with skin compromise, then it continues with that flows of the muscle, and then essentially when all of the blood supply has gone all the way down, gangrene is the end result. We will then proceed with palpation. Palpation of the lower extremity first starts with palpation of temperature, just like we did before in the upper extremities. And we will also check the pulses of the lower extremities, which will be as follows. The femoral, which has been mentioned before and will not be demonstrated in this lab. The popliteal pulse, which is usually done by first semi-flexing the appropriate leg and inserting the index, middle, and fourth digit from both hands in the popliteal fossa and then directed towards an upward area of the popliteal fossa. It's then repeated on both sides. Please note that this is a deep pulse and requires some pressure to actually be able to palpate it. We'll then proceed with the dorsalis pedis. This pulse is going to be palpated in the area of the dorsum of the leg, usually following along the region of the flexor of the great toe. It is usually a light pulse and so only requires light pressure. We'll continue then with the posterior tibialis. This is done by locating the medial malleolus and inserting the digits of the both hands, the index and the mid finger, in the region behind the malleolus, and you will then palpate anteriorly towards the bone of the malleolus to feel for this pulsation. There shall also be the test that is done for the insufficiency of the arterial compromise in the lower extremities, which is called the Berger's test and shall be demonstrated as follows. The patient then has to be lying on bed and both legs are raised to approximately 60 degrees. The patient is then asked to wriggle his or her toes, and this position is maintained for a timed 60 seconds. When this time approaches, by this stage the limbs should be somewhat pale as we have reduced the blood flow to those lower extremities. At the end of that time, you will have the patient sit up and swing his legs over the side of the bed, and you will observe the feet, looking for color returning and vessels filling. Remember, the color should return within 10 seconds and the veins should actually fill in within the first 15 seconds. So we'll now proceed with swinging to the side, and you will observe the feet for color return and venous filling. Remember, depends on the ethnicity of your patient. If the skin is a bit dark, we can actually look at the soles of the feet and the side to see the obvious signs of color return. When assessing the peripheral pulses, we have to keep in mind that aneurysms can affect virtually any artery in the body, so inspection should have included also checking for pulsatile masses in the popliteal and femoral regions. Auscultation is also a test that is included for the lower extremities, but we will not be demonstrating it in today's lab. Auscultation of the femoral pulse for bruits should be included, and if an aneurysm is suspected in any of the arteries, then the specific artery will be auscultated. But as mentioned, we will not be doing it in our lab. We will then proceed with examination of the venous system. For the venous system, we will limit our focus on the examination of the venous system to the lower extremities only. This does not apply that they cannot be compromised in upper extremities, but it's just less frequent. So we shall be doing the inspection and palpation and 4 special tests. And this inspection will involve assessing primarily for signs of venous insufficiency. Now, during the inspection of the venous system, the patient should remain standing, while measuring the size of the calf of the patient can either be done sitting upright or lying in bed. While testing for deep venous thrombosis, the patient should be lying down, and the location of the insufficient valves and varicose veins, which is called manual compression, and the Trendelenburg burst test, requires the patient to be standing. So we will first start by assessing and inspecting the limbs for symmetry. This symmetry should be symmetry of size and shape. They should be done both anteriorly as well as posteriorly. We should also be looking for any discrepancies that may indicate that there are the presence of deep vein thrombosis, and we should be looking for swelling of the leg as well as the presence of edema. We should also be inspecting for any surgical scars that may indicate previous surgeries that might really compromise the vascular system. We shall also be inspecting the limbs for color. In this case, we shall be checking for hyperpigmentation or scaliness. And we shall also be looking for any increase that can indicate some sort of venous disease, something that is usually called stasis dermatitis. And this is usually due to decreased blood flow back towards the heart through the veins. Please note that any erythema which can indicate the presence of deep vein thrombosis shall be taken note of as well. We will also inspect around the medial malleolus, primarily in the anterior and superior part of the medial malleolus, for the presence of ulcers. These tend to occur here because of the great saphenous vein passes anteriorly to this area. Ulcers may occasionally occur around the lateral malleolus in venous disease, as small saphenous vein passes inferiorly and posteriorly to the lateral malleolus. Don't forget to inspect with the patient in the standing position. Also, do not forget to inspect the posterior leg as well as the soles of the feet. We will then proceed with palpation. The limbs have to be palpated first for tenderness, asking the patient if he feels any pain, or looking at his facial expression for the grimace. We will also be palpating for temperature changes. This should be done comparatively, remembering that an increase in warmth may indicate venous disease. We will also be palpating for cords which may be present in superficial thrombophlebitis. And we will then palpate the limbs, assessing for pitting edema in 3 primary areas of the dorsum of the foot, posterior to the medial malleolus, and anterior to the tibia. We will then proceed with the measurement of the calf areas. For this, we will ask the patient to sit or lie. The measures should be ideally with graduations in inches or centimeters, but we will be focused on the inches. The procedure is done first by asking the patient to semi-flex one leg. We will then locate the tibial tuberosity on that side, place our tape measure, and we will measure downwards to the area of widest calf muscle girth. At that point, we will then check the diameter. This measurement should be done in inches. We will then do the same on the opposite side, using the same distance from the tibial tuberosity, and the same procedure for getting the diameter. These 2 values will then be compared for symmetry, as well as be noted for future evolution of a patient to see how the measurements are changing with time. This indicates the progression of venous compromise. We will then proceed with the special tests. These should be done when evaluating the patient for deep vein thrombosis, and they're called the Pratt's test and the Homan's test. We'll first start with the Pratt's test. For this, we will ask the patient to semi-flex one leg to around 45 degrees. We will then place both of our hands, applying pressure with our fingers from the back and placing our thumbs to the front, and we apply pressure anteriorly, looking for signs of pain. This will then be repeated on the other side using the same procedure, applying the pressure anteriorly towards the tibia. We will then proceed with the Homan's test. This should also be done with the knees flexed at 45 degrees. The examiner holds the foot and he will be displacing it upwards, looking for signs of pain. This will be done also with the other extremities. Please remember here that the Achilles tendon is what is going to be stressing, which is going to be pushing pressure on the soleus muscle. Now, what is necessary to do is to avoid false positives by the gastrocnemic muscles being injured if this test is done in an extended knee position. We will then proceed with a test for the integrity of the valves. These two tests are called the Trendelenburg test and the manual compression. We will first start with the manual compression test. For this test, we will need the patient to be standing, and we will inspect the lower extremities for any signs of varicosities, attempting to map out the course of the varicose veins if we did in fact encounter it. We will then place both hands at a distance of 10 centimeters apart, using primarily our index and middle finger. First, the hand will be placed of the right hand of the examiner with index and middle finger for about 2 to 3 seconds. Then the second index and middle finger of the left hand will be placed 10 centimeters away, trapping a column of blood in between both. You will then use the index finger of the left hand to tap lightly on the column, and this should be felt on the other end because that is the normal direction of flow. And then we will do the opposite using the index finger of the right hand and tapping lightly. This should not be felt if valves are fully functional. It can then be repeated in any other compromised vessel on the other extremities. We will then proceed with the test for valvular insufficiency, that is called a Trendelenburg test. For this one, the patient will have to be lying. You will be raising one leg to an angle of approximately 90 degrees, at which point you will have the patient wriggle his or her toes, which assists in the emptying of the vessels of that extremity. This should be done for a duration of 60 seconds, at which point a tourniquet will be used to tie off that blood flow at approximately the midpoint along that thigh muscle. This should only be done at the end of 60 seconds. The degree of pressure should be tight enough to occlude the superficial vessels but not the deep vessels of the legs. The patient is then asked to stand, and you shall be observed with the leg for venous filling. This is going to be done in two parts. The part one is done with the tourniquet still on, and it's the normal flow, should be from the superficial to deep. If there is compromise between the communicating vessels, there will actually be flow from deep to superficial, and you will see rapid filling. Observation is done for 15 to 20 seconds, and then the tourniquet is removed. And here we will be looking for rapid filling from superior to inferior if there is backflow because, again, of valvular compromise. Again, the observation is done for up to 20 seconds. The reporting of this test shall be done as follows: positive or positive, where the first indicates the filling of the communicating vessels and the second indicated the filling of the superficial vessels. The same procedure is then repeated on the other extremity. We shall then proceed with the examination of the lymphatic system. Please note that parts of the lymphatic system have already been examined in the head and neck exercise, and so for this one we shall be focused on the lymphatic system that is adherent to the upper extremities and the femoral system of the lower extremities. The palpation of the axillary and the epitrochial lymph node is easiest done with the patient either sitting or standing. Palpation of the femoral lymph node, however, requires the patient to be lying down. First, we will inspect the upper and lower extremities, observing for any obvious signs of swellings, which may indicate an inflamed lymph node or lymph node chain. Remembering the location of the groups. In the lower extremities, the femoral group is also very indicative. We shall then proceed with the palpation of the lymph nodes of the upper and lower extremities, in which case we shall be first observing for size, shape, mobility, consistency, and tenderness. We will then start with the examination of the epitrochial lymph node. First, we will need to locate the lymph node, which is directly above the medial epicondyle, about 2 finger breadths, or approximately 2 inches. Palpation will be done moving in the circular fashion, and again we will be checking to make sure that if there are any enlarged lymph nodes, that we check the size, the shape, mobility, and consistency, and check also for tenderness. We shall then proceed now with the examination of the axillary lymph nodes. The axillary lymph node shall be done visualizing the area of the axilla as a pyramidal shape, and there shall be a few groups that are going to be examined. First, we will start by holding the arm of the patient in a semi-abducted position, and with the palpating arm we will first start with the medial group, which is examined against the lateral wall of the chest, palpating in a circular manner. Then we will examine the lateral group against the humerus. Then the anterior group, which is examined against the fold, the anterior fold of the axillary region. The posterior group, which shall be examined against the posterior fold of the axillary region. And then the apical group, for proper examination, the arm has to be brought all the way down so that we can properly insert our fingers to the highest apical point for that examination. Again, the parameters of the inflamed lymph node shall be observed here if they are felt. We shall then proceed to do the same in the other extremity. The last will be the femoral lymph nodes, and this should not be done in the lab. So a review of the anatomy and the pertinent area will be expected, even though the procedure will not be demonstrated here. This concludes the examination of the peripheral vascular system.